Hello and welcome to JustStreetSense.com, sponsored by the Centrist Foundation. I'm here today with Rich Como, and we'll talk about health insurance in light of Obamacare. And before we get started to the subject at hand, just a quick introduction of Rich Como. He and I have known each other for over 40 years, so I'll let him introduce himself real quick, then I'll come back and introduce myself.
Hi, this is Rich, and I've spent about 40 years in the information technology business. I've been an active investor for about 30 years. Recently retired, and have chosen to work with Abe and produce this website and try to get some good information out to people that they can use.
Welcome, Rich, and this is Abe. If you would like to know more about us and information about us, please go to the staff directory at JustStreetSense.com. And you'll be delighted to know that we've been around for a while. So let's get started. Rich, why don't we get started on how policies are rated and loss ratios and difference between health and property insurance, if you may.
Okay, before we get into that, I'd like to talk a little bit about why insurance is necessary in the first place. And the basic reason is that people are faced with expenses that they really cannot cover by themselves. An easy example is a house. You might buy a house for $100,000, but you really don't have $100,000. So you go down to the bank and you borrow some money, and now you have a loan obligation. If something bad happens to that house, like a fire or a hurricane, you don't have a house left to live in, and you don't have $100,000 to pay the loan off either. So insurance is a method of sharing risk with many other people who are faced with the same potential loss, but it's not likely that a lot of people are going to incur that same loss in the same year. So by collecting a small premium from a lot of people, the insurance company can then pay off the small number of losses that are expected to occur in a year. So that's how. That's why we need insurance. Why people buy insurance. Abe has worked in the insurance industry, and so Abe, why don't you explain to us a little bit about how policies are actually rated and what the loss ratios are?
Okay, Rich, real quick, loss ratio is what the company decides that they can charge and make an operating profit and stay within the state laws. Not to get into too much detail, states usually set a premium limit that the insurance company can charge, and they can discount below it or they can charge you more if they get permission from the states. And the loss ratios are determined by value of the property, the types of losses that you can incur, the deductibles that you choose on your property, and that will determine the premiums that you pay. In relationship to healthcare, and which Rich and I will get into more in detail, it's about rating a property. In the health insurance, it's about rating the person. That's where you have the moral and emotional issues coming up, and it gets politicized to do that. The other things that's happening in the health insurance industry is the charity hospitals that used to be there really don't exist anymore. And what do I mean by charity hospitals? The only large charity hospital that exists now is the Shriners Hospitals, which provide free care even if you have the ability to pay. And I'm going to turn it over to Rich to talk a little bit about elder care and what's going on presently, and then we'll tie it all together in the light of Obamacare.
Okay. Basically, we decided as a country back in the mid-1960s that people over 65 years of age would be eligible for coverage under a system called Medicare. And the reason that I think the federal government had to step into that marketplace is that as people age, they tend to get more illnesses, both serious and illnesses and ongoing illnesses, and so the expense would go up. If in a natural marketplace, the expense would go higher and higher to insure older people. Of course, these people are retiring and they're losing, their regular income stream. They may have a pension, may live on income from savings, but generally their income is going to go down from their normal working career at a time when their insurance premiums would be going up quite substantially. And so...
and there'd be a lot of other people who don't even have insurance or the income to support an insurance at that age.
Right. So the government stepped in with a program called Medicare, and that's how the elderly, people over 65, are covered for insurance these days. Okay, now there are some issues with Medicare as far as a national policy point of view, and the primary issue is that we spend an awful lot of money on Medicare. In fact, the budget debates going on in Washington right now have to do with entitlement reform, and Medicare and Medicaid consume a substantial amount of the national budget each year. And so we need to talk about how to limit those expenses in the Medicare system and use the money more wisely than we have in the past. Some of the problems that we've seen in the healthcare system, particularly with the elderly, is as they get very sick and maybe facing a point where they're really not treatable anymore. The doctors tend not to have discussions with patients about what their options really are. Sometimes the doctors will simply prescribe a remedy, and it's really not going to extend the life of the patient very much.
Or nor make them comfortable.
Right. In some cases, it can substantially decrease the quality of life while providing very little benefit to the duration of the life.
And Rich, having dated a few nurses, one of the stories that I hear from them is Granny is 92 years old. Granny's not going to go home, but the family members tend to make outrageous demand on the medical staff to extend the life of Granny. And there's controversy about how much money is being spent at that stage. There's talk of about 10% to almost 30% of all expenses paid to a patient for a patient are done in the last year to 6 months of their life. Especially, putting somebody, you'd gone through a personal experience with your mom about somebody being at 89 or 92 that's going through dialysis, and the doctors never had a rational discussion with them. You and I have been kind of lucky that you have family members who are in the health industry, and I've studied health industry, and I've been out there hanging out with a lot of doctors and nurses. It seems like the doctors and nurses tend not to have rational discussions about end of life, about end of hospice. On a personal basis, when my brother was diagnosed with cancer, he was a young man. They ran hundreds of thousands of dollars worth of tests, which didn't do anything for his health, didn't do anything for his comfort or prolong his life. It was almost like a running scoreboard on a weekly basis, daily basis. I would get blood count levels from his kids. And finally I had to go talk to the doctor and have a rational discussion and put my brother in hospice to where he could be taken care of better, be home, be in a safe, nurturing environment, and be cared for rather than being stuck in a hospital bed. What do you think about that?
Well, those are the types of issues involved in Medicare and reform. The question here really is, are these doctors and hospitals primarily concerned with the care of the patient, or are they primarily concerned with padding their income?
Excellent point. That's something I wanted to get it out there. Being centrist, and we have made a promise that it's no holds barred. We're going to look at all sides of the extremism on the left and right and expose whatever we can. And that's a good point about padding the bills, to where I've looked at home health care companies. There was one in Louisiana that just made the news up there in Ruston, Louisiana, where the guy was from African country, had bought several home health care businesses and nursing care businesses. He was padding the bills, making millions of dollars, scamming the government, living large, and then declaring bankruptcy and not paying his staff. Those are the things that are kind of really hurting the system, and you and I've researched to where there's 10 to 15%, maybe even more of costs that can be realized, cost cutting that can be realized, expenses cut, if we could expose those kinds of scams and get rid of those kinds of operators and bring it back to where it's rational and care. Kind of transitioning back to, you and I have talked about in person about Greyhound therapy. Do you want to get a little bit into indigent care and how the rest of the world works in that area? And then we'll jump into pricing that the drug companies do and implants.